In this video, I will discuss hepatitis B vaccine that can prevent liver cancer related to the infection from hepatitis B virus. First, I'm going to briefly discuss what is hepatitis B virus, how it is transmitted, and its impact on humans. Hepatitis B virus is an enveloped double-stranded DNA virus. The viral envelope contains hepatitis B surface antigen. The envelope surrounds the nucleocapsid, which is composed of hepatitis B core antigen. The virally encoded DNA polymerase and the viral DNA genome are encircled by the nucleocapsid. Hepatitis B virus infects the liver and causes both acute and chronic hepatitis B. Chronic hepatitis B can lead to primary liver cancer. Hepatitis B transmission occurs through infected blood, semen, or other body fluid. For example, newborns can get the infection from their infected mothers. Hepatitis B transmission can also occur through sharing needles, syringes, toothbrushes, razors, etc. People can get hepatitis B infection through direct contact with blood or open sores of an infected person or having sex with an infected partner. Worldwide, about 296 million people were living with chronic hepatitis B in 2019. There are 1.5 million new hepatitis B infections each year. In 2019, hepatitis B caused about 820,000 deaths, mostly from cirrhosis and primary liver cancer. In the United States, as many as 2.2 million people are living with hepatitis B. Hepatitis B disproportionately affects Asian Americans and Pacific Islanders, who also have higher incidence of liver cancer. In the United States, roughly one-third of liver cancer cases are related to hepatitis B and another third are related to hepatitis C. Unlike chronic hepatitis C, chronic hepatitis B is not curable. Hepatitis B vaccine can effectively prevent hepatitis B viral infection. Therefore, hepatitis B vaccination is critical to the prevention of hepatitis B and hepatitis B-related liver cancer. Hepatitis B vaccine is recommended for the following groups of people who are at risk of hepatitis B infection: newborns, unvaccinated children and adolescents, people who live with someone who has hepatitis B or who have sexual partners with hepatitis B, people who work or live in a facility for the developmentally disabled, healthcare workers and emergency responders, men who have sex with men, people who have multiple sexual partners, IV drug users, people with chronic liver disease or end-stage kidney disease, people planning to travel to an area endemic with hepatitis B. There are 3 hepatitis B vaccines available in the United States. They are Engerix-B, Recombivax HB and Heplisav-B. Engerix-B and Recombivax HB are indicated for people of all ages. These 2 vaccines are given intramuscularly in 3 separate doses in 6 months period of time. In contrast, Heplisav-B is indicated for adults 18 years of age and older. It is given intramuscularly in 2 doses with an interval of 1 month. Heplisav-B is unique in that it contains a novel adjuvant called cpg-DNA, which is a synthetic immunostimulatory oligodeoxynucleotide. This new adjuvant, as compared to the aluminum adjuvant in other 2 hepatitis B vaccines, can stimulate more potent immune response. In summary, hepatitis B vaccination helps prevent hepatitis B and primary liver cancer caused by chronic hepatitis B infection. Please consult your primary care providers to see if you belong to the at-risk group who need to have hepatitis B vaccination. Thank you for watching.